You know what they say, it's what's on the inside that counts. If you've always wanted to work in healthcare, but you're looking for something a little less invasive, maybe a career in medical sonography is just for you. Here to talk to us more about the medical sonography program at RCC is Lindsay Norris, Program Director. Lindsay, tell us more about the sonography program here at RCC.
Yeah, so it's a curricular program that will provide students with the knowledge and the clinical skills to use high-frequency sound waves to take images inside the body. This program will also properly train the students how to use the equipment, how to take diagnostic images, and how to document findings.
What kind of job opportunities are available for a career like this, and what's the pay grade like?
So the graduates may be eligible to work in clinics, physician offices, hospitals, and educational institutions. Right now, the average pay scale for an entry-level sonographer is $30 to $38 an hour.
And just curious, are there any specialty careers in sonography? And if so, are there any further requirements necessary?
So specialty careers may include abdominal, OBGYN, breast, musculoskeletal, pediatrics, and vascular. And if the student does choose to become more specialized, they would just take those appropriate certifications to receive those credentials. There's cardiovascular sonography that if the student chooses to pursue that, it would be extra education and certification as well.
And I imagine more pay.
Yes, more pay.
So how do I get started? What are the steps I need to take? Are there any requirements?
So students that will be applying to the program need at least a 3.0 GPA in the general education courses that are required for the program. These include Bio 163, which is basic anatomy and physiology, or they can do Bio 168 and 169 combo. There's also Physics 110 and 110A, which is conceptual physics, Math 143 or higher, English 111, English 112 or Com 231, a social behavior elective course, and a humanities elective course.
And what makes medical sonography a good career path to take?
Medical sonography is challenging, but it's also very rewarding because it kind of helps guide the physician's diagnosis and the treatment plan for the patient. I also believe it's a good career path because it's very broad and there is many career opportunities and advancement.
So what's a typical day look like for a medical sonographer?
So it depends on really where you're working at. So if you're at a hospital, you may be doing OBGYN, abdominal, vascular, a little bit of it all. If you're at a physician's office, you may be just doing OBGYN. You'll just be doing that all day. And also, it's just not always a 9-to-5 job. Sometimes you may work weekends or night shift. Of course, you'll be compensated for that pay also. Sonographers also take call sometimes, so that's another way to just get a bonus extra pay.
Perfect. Well, let's check in with one of your students now and hear their testimonial. This is Emma Turbeville. She's a soon-to-be graduate of the medical sonography program at Robinson Community College. Emma, how has this program helped you to achieve your goals?
As a 2-year program, it really helps me to get my degree quickly in an affordable and convenient manner. I feel like I like sonography because there's many different ways you can go with it.
All right, well, what are your plans?
I plan to become a registered vascular technologist, possibly getting my registries in abdomen and OBGYN as well. I also plan on getting my bachelor's degree in healthcare administration whenever I'm done.
And just curiosity, so getting those additional certifications, is that additional time in the program?
No, it's not. I actually can just take my registries after I'm finished.
And is that to make yourself more attractive in the workforce?
Yes, it'll make me look a lot more attractive to different kinds of sites, different kinds of labs. It really helps getting jobs.
What would you say to someone considering a career or a future in medical sonography?
I say go for it. There's a bunch of different ways that you can go. There's a bunch of different tests you can take. There's different kinds of pay levels that you can do. I really like sonography because of all the things that you can learn and how much you can learn.
And you must be enjoying your time here at Robinson Community College. What would you say to someone considering enrolling at Robinson Community College?
I say don't overlook community college. You can always take classes here if you're not sure what you want to do before you go to a 4-year. So take your classes here, go to the 4-year. There's also different kinds of healthcare programs that you can do if sonography doesn't seem like something you'd like. There's radiography, respiratory therapy, and nursing.
Well, thank you, Emma. Best of luck to you. Thank you as well. We'll see you next time on the Carolina Beat.